So good morning, everyone. Once again, you are very welcome to the G-WAC Policy Dialogue. I would like us to, in the tradition of the Kwame Nkrumah University of Science and Technology, which is hosting this, to have a word of prayer in line with our protocols. Shall we pray? Thank you, Lord, for this opportunity that we have to meet and to dialogue. We invite you to be with us and to lead us, help us, so that whatever we do here will be useful, will be successful, and will inure to the benefit of those we serve. We pray in Jesus' name. Amen. Thank you very much for coming. I am John Amuesi, and I'm the acting director for G-WAC here in Ghana. And my colleague Vilm is the director of G-WAC in Germany and the PI overall of the project and the collaboration of the centers. There will be a proper time for introduction. There's not too many of us, so we will definitely have a round of introductions, which I'm sure the chair will take care of. But because of the time constraints, we will just jump straight into the program for now. If you look on the program, there's supposed to be, and can I kindly have the projection there? We're supposed to have the welcome and purpose of the gathering. Now, I've often wondered about this tradition of the purpose of the gathering, because once people gather, the presumption is that they know why they have gathered. But nonetheless, it is always good to spell out so that if anyone is in the wrong place, they have the opportunity to excuse themselves. So we are here this morning, and let me just point out that the channel 2 is for the French translation. So for those of you who would prefer to follow in French, please use channel 2 on your device. You must be familiar with this. So you turn it on here, and then you change the channel on my left-hand side. You can change that to the French channel if you need it. So this is the first in the hopefully a series of policy dialogues, and it's the first biennial West African policy dialogue on pandemic preparedness. And we have themed this capabilities for better data, better analytics, and better decisions. Our chairpersons and others would get into the details of this. And we have many of you who have come from Europe and also from West Africa to join us, and we are really elated to have you. I know that a number are also on their way. His Excellency, the Commissioner of Health for Lagos State, I know is on his way, and a few others too are on their way. I'd like to right away request Dr. Linda Deborah to come and introduce the chairperson, and then we will go from there. So, Linda.
Thank you very much, Dr. Amuesi. This morning, we are happy to be gathered here, and as a gathering, we will need somebody to steer the affairs. We are very proud and we are happy that the person who will take the seat is a proud son of the Kwame Nkrumah University of Science and Technology. He is a researcher. He has been researching in global health for so many years. He has worked with the Kintampo Health Research, even for about 17 years now. He's currently with KNUST as a professor and as the Dean of School of Public Health. He is a professor in global health. Ladies and gentlemen, I'm very happy that even our chair is also a member of the G-WAC committee. Please, let's welcome Professor Samuel Newton to take up the chair. Thank you very much. I'll then hand over the mic to him so he continues chairing the affairs.
Hello. Thank you, Linda, for the introductions. My work has been made very easy because of the part John played in introducing the reason why we are here. So, first of all, we want to welcome you all to this meeting. As he said, capability for better data, better analytics, and better decisions. And we hope that from the lectures which we'll be hearing, we'll be able to learn something which would improve the work which we are doing. We from KNUST are delighted by G-WAC. Already G-WAC is a household name on KNUST campus because of the good work which is happening. And really appreciate and welcome you all from the West African states and also from Europe who have come here to join us, and more especially our guests who we invited who have also come here to be with us. So thank you very much, and we'll go straight to the program and take a message from the German ambassador, His Excellency Daniel Krul.
Good morning, Chairperson, Deputy Minister of Health, Deans of Colleges of Public Health, and Acting Directors of G-WAC, distinguished dignitaries at the high table, distinguished participants from Ghana and beyond. Bienvenue, welcome à tous les participants du monde africain de l'Ouest. Today is a very exciting day, not because of your seminar, but because Germany might be kicked out of the World Cup today. So we are all very excited. I understand you all know why you are here. I would be surprised if not. Just maybe let me then focus more on why Germany and why the German government is supporting G-WAC, and why we are so happy that we have today the first dialogue on pandemic preparedness. Our support for G-WAC is part of a pattern we follow in the support of building networks in West Africa. Germany, since more than 25 years now, is supporting the KCCR in Kumasi. We are supporting in social science the MIASA project in the University of Ghana, and we support the Vascal Institute, which is a gathering of 11 countries working on livelihoods in times of climate change. So as you can see, all these institutions have one focus, and the focus is on building regional networks. And this is my understanding of G-WAC as well. In the field of pandemic, it's our main interest is supporting you in your aim for capacity building in your respective countries. And we hope to strengthen the networks with you, because we all know that the pandemics are not over. They will come back, that's for sure. We don't know how and when and where, but we need to be prepared so that once they pop up again, that we all together jointly find responses to the challenges in a very timely manner. So with this, I would like to wish you a very fruitful seminar, and looking forward to hearing from you about your results. Thank you very much.
Thank you, Ambassador Krul. Thank you. So we are now going to have a message from the Provost, and to deliver the message is Professor Daniel Anson, the Dean of the School of Medicine and Dentistry, KNUST.
Thank you, Sam. Right, so I bring you warm greetings from Kwame Nkrumah University of Science and Technology on behalf of the Vice Chancellor, the Pro-Vice Chancellor, the Provost, and the entire faculty of the College of Health Sciences, which is the host of the G-WAC program. It is a privilege to have this opportunity to lead this very important agenda, and the message from the entire university to this gathering is to support the initiative that the directors have taken on, and believe that with the appropriate collaboration, networking, and partnership, partnership as well as good stakeholders engagement, we should be able to address challenges that are posed by emerging diseases on our continent. On that note, I would thank you all for coming, those who are traveling within West Africa and from Europe, to this very important meeting. Thank you very much.
Thank you, Prof. Anson. We want to invite Professor Wilm Quentin, the director of G-WAC, part of the G-WAC process, to give the opening comments, after which we would have the Deputy Minister of Health to give her speech. Thank you. Wilm.
Yes, thank you very much. As the director of G-WAC, you may know that I'm from the Berlin University of Technology, but what you maybe don't know is that I have also worked for a long time for the European Observatory on Health Systems and Policies, because at the Berlin University of Technology we are one of the hubs of the European Observatory. And the idea for this policy dialogue really goes back to this European Observatory on Health Systems and Policies, which aims to bridge the gap between policy making and research, or between research and policy making. It's a bi-directional gap, I would say, and the purpose is to support evidence-informed policy making, and the policy dialogues are one of the approaches of the European Observatory to bridge this gap between research and policy making. And I would like to highlight a few characteristics of these policy dialogues which I think are important and which we should bear in mind now for the next 1.5 days, as we are here together to discuss the capabilities for better data, better analytics, and better decisions. And this is that first, policy dialogues should ideally be demand-driven. So when the European Observatory is doing a policy dialogue, usually there's a request that comes from a national government or from a group of national governments to support them in making a new policy or preparing a reform. And in this case, because this is a new initiative to establish the West African Policy Dialogue, we didn't yet have a request from a government to do this, but we believe that with starting this initiative, we can generate the momentum to get this institutionalized, hopefully within the next 2, 4, 6 years, and that in the future there will be really requests from national governments in West African countries to receive evidence from researchers who are part of G-WAC, but also from other researchers in the region to support them with providing evidence for new policies. And another point is that these policy dialogues should be neutral, and that's always when evidence is presented and we are presenting evidence. We do this in a non-prescriptive way, so because usually there are many different options to address certain problems, and so these different options should be put on the table by the researchers and explained what are the benefits and disadvantages of these different options. The policy dialogue, I hope, will be informal and neutral, and nothing should leave the room. Usually we say that they are following Chatham House rules, so that means everything that is said will stay here in the room and shouldn't go out. You may see the media right now, but they will leave after the opening ceremony to make sure that everything can be put on the table, openly discussed, that we can address differences between research and policy making, that data problems in different countries can openly be discussed and shared amongst each other, because it is important to put these things on the table in order to be able to address and discuss how they can be solved. And policy dialogues are usually focused, tailored, targeted, so they really, once there is a question that should be addressed by the policy dialogue, there are several iterations where we usually go back to policymakers to ask what is really the problem that needs to be addressed and what are the topics that we should discuss within the policy dialogue in order to be able to address this policy problem. And the idea is often also that by bringing policymakers and researchers to the table, that the researchers provide the evidence, but the policymakers then provide the context, and the context they know really how this evidence can be implemented, and how this evidence can inform the policies, what the researchers often are not aware of. And this means that in the long term, there should be ideally shared ownership between researchers, and we are only starting this initiative, but in order to be successful in the long term, there has to be also a buy-in by either regional, international organizations or national governments in the West African region. And the reason why we thought this initiative was useful and it would be possible to introduce this is because 5 years ago, we started a Ghana health policy dialogue as part of another project, and we have just come back from a 2 days Ghana health policy dialogue in Ho here in Ghana, where we discussed with several people of the Ministry of Health and of the Ghana Health Service, the National Health Insurance Authority, possibilities to assess the performance of the Ghana health system. And it was a very active, very open meeting, and the problems were really put on the table, and we learned what the problems are in between for researchers to get access to data, because they don't show sufficient respect for the policymakers who have the data, and there were really open, very live discussions about this. And the policy dialogue, although we started it more or less, the idea 5 years ago, it's now really owned by the ministry, and they define the topics for the policy dialogue that usually come up out of the health summit, and then we gather together and provide evidence that can inform the policies. And I hope that once the media has left the room, we will have as open and vivid discussions here over the next few days, because the topic is so important that nobody should be afraid to really put the things on the table and spell out the problems clearly that they have with data analytics and decision making. And with that, I would really like to give back to the chair.
Thank you, Professor Phil Quentin. Next, we're going to have Honorable Tina Mensah, the Deputy Minister of Health, who is representing the Ministry of Health, to give her opening remarks. Thank you.
Thank you, Prof. Prof. Chair, Your Excellency, the German Ambassador to Ghana, Provost KNUST, Director G-WAC, WHO Directors and Heads, distinguished participants, ladies and gentlemen. I am honored to join you in the first Biennial West African Policy Dialogue on Pandemic Preparedness with the theme, Capabilities for Better Data, Better Analytics, Better Decisions. I am informed that this Biennial West African Policy Dialogue on Pandemic Preparedness is part of the novel initiative of the newly established German West African Center for Global Health and Pandemic Prevention, based at the Kwame Nkrumah University of Science and Technology, KNUST in Kumasi, and is designed to support the global health agenda to build capabilities for better data, better analytics, and better decisions for emergency preparedness and response. This forum is very timely, especially in the aftermath of the recent global COVID-19 pandemic, Melbourne virus disease, and monkeypox outbreak, among many. For us in Ghana, we have adopted a multi-sectorial, multi-pronged approach in response to these outbreaks, and the level of commitment remains high. However, the importance of timely, reliable, and relevant information for timely decision-making before, during, and after this event is highly crucial in any country's response and in the sub-region. The ministry has put in place surveillance and data systems to ensure the timely availability of data to inform the various stages of public health events, through prevention to detection to the response. These systems have provided the bedrock for launching and tracking of our response systems, and provide the relevant information to inform governance, coordination, and accountability decisions, and also to ensure that the impact of events are minimized. It is, however, important to note that just having the data available does not translate into the necessary response until the data is analyzed and utilized to inform strategic decisions related to response to pandemic and epidemics. Additionally, the role of the health research in producing some of the data cannot be overlooked. Instituting such a program within the West African sub-region also empowers us to make timely response decisions, contain events, and address cross-border transmission. Such a program will provide the impetus and information for a strengthened cross-border collaboration in response to events. I must emphasize that we live in a global village, and whatever happens across our borders should be of concern to us and should impact on our individual and joint response decisions. We are grateful to be the partner KNUST College of Health Sciences in Ghana, the Berlin School of Public Health, including Technische Universität, yeah, I'm speaking Germany. Universität, yeah, Universität Berlin, and Charité Universität Medizin, Berlin, and Medical Faculty and University Hospital Bonn in Germany, and the Robert Koch Institution for instituting such a project. I believe this project will go a long way towards contributing to building the relevant capacities for evidence-based decision-making for effective response. I will urge all the collaborating partners to continue to work closely to ensure that objectives outlined for the project are met. Thank you, and I wish you a successful meeting. And may I add to it, I wish I could stay with you throughout the program, but I have another call to be in Parliament within the next few minutes. So I'll take my leave after this. Thank you very much, and God bless us all.
Thank you, Honorable Tina Mensah, for coming and attempting to speak German. We really appreciate your efforts. So thank you very much.
You're welcome.
So you may leave. Okay, I think it's appropriate that we introduce ourselves so that we know who is here and who we are. So we would start, I think I would start off and we would go clockwise. So I'm Sam Newton, already introduced, the Dean of the School of Public Health, KNUST. So I think we would go this way. So just introduce yourself so that we know who you are. Just a round of introductions. Thank you, Tina.
Okay. Hello, so my name is Anne Meyerkort. I'm a medical doctor by training, and I am part of the Robert Koch Institute. I'm a researcher there, based in the Center for International Health Protection, and I am basically part of the project that we conducted to help with the strategic rollout of the new WHO Hub for Pandemic and Epidemic Intelligence.
Thank you.
Thank you. My name is Joanna Hannefeld. I'm the director of the Center for International Health Protection at the Robert Koch Institute in Berlin, Germany's National Public Health Institute. And I'm also a professor of global health policy at the London School of Hygiene and Tropical Medicine, and in that role, part of the G-WAC consortium.
Thank you.
My name is Achim Hörl. I'm Director and Chair of the Institute of Medical Microbiology at Bonn University Hospital Center. So we, as you might have known, there is Berlin and Bonn and KNUST, so in a tripartite consortium that we are leading the G-WAC, and I'm one of the coordinators from the Bonn side. My research is mainly focused on NTDs, and we bring in here NTDs sort of as a litmus and basis for capacity building and also lab knowledge in order to be better prepared for the future.
Yeah, I'm Walter Bruchhausen from also the University of Bonn, where I'm the professor for global health. I'm the co-director of G-WAC for the Bonn side, and in my own research and teaching, I mainly focus governance issues, which are, as we all know, extremely important in issues of pandemics. So the trust of the populations, the influence, possible influence on human behavior is central in overcoming the threats and the challenges of pandemics.
My name is Christine Müller. I'm from the International Office of the University of Bonn, and I'm here at our Erasmus program. So this is an Erasmus Staff Week for the two of us, and we try to support research and scientists best from administrative side, and so I'm happy to learn what might be needed. Thank you.
So I'm Hannah Weisheit. I'm currently doing my year of voluntary service in the International Office of the University of Bonn in the department of Christine Müller, so I'm here for the same reasons as her.
Hi, my name is Philippe Eldur. I am a research scientist with the Institute of Virology Charité, conducting collaborative research projects in virology in Ghana and other African countries, and I'm a scientific coordinator on G-WAC.
Hello, my name is Linda Deborah, and I'm with the Kwame Nkrumah University of Science and Technology as a medical parasitologist working on NTDs with filariasis as the main focus. I'm a member of the G-WAC management team.
My name is Gordon Awandare. I'm a professor of biochemistry, soil and molecular biology at the University of Ghana. I'm also the founding director of the West Africa Center for Cell Biology of Infectious Pathogens. Our center is involved in genomic surveillance and as well as seroprevalence studies for the current pandemic response. Thank you.
My name is Daniel Opoku. I am a lecturer at the KNUST School of Public Health and also a research scientist at the Department of Healthcare Management, Berlin University of Technology under Professor Reinhard Busse. And I also lead the eHealth Research Partner Group at the KNUST. Thank you.
I'm Alexander Adebra from KNUST. I'm a former Dean of Faculty of Allied Health Sciences, and I'm a professor of NTD and Global Health. I'm part of G-WAC management team at KNUST. Thank you.
Yeah, I'm Benjamin Emikpe. The Dean of the School of Veterinary Medicine, KNUST, the lead for Ghana in the area of zoonosis and what G-WAC. I'm a professor of diagnostic pathology. Thank you.
Hello, I am Rodion Konu from, I'm medical epidemiologist at the University of Lomé and University of Bordeaux, Global Health and Global South team. So I think that's all.
Hello, my name is Romain Glele Kakai. I'm professor of biostatistics at the University of Abomey-Calavi in Benin. I'm alumni of the Alexander von Humboldt Foundation, and currently I'm coordinating a Humboldt research hub on socio-ecological and spatial-temporal modeling of COVID-19 in Africa. Thank you.
My name is Ali Sie. I'm a medical doctor and technical director of NUNA Health Research Center in Burkina Faso. That is part of National Institute of Public Health at the Ministry of Health in Burkina Faso. I'm working in global health, mostly in health system management and performance. And I'm also responsible of the Health Information System program at the National Institute of Public Health. I did some work on evaluation of health information system in West Africa countries,
including Burkina Faso, Togo, Guinea, and Sierra Leone. And thank you.
Merci. Je vais m'exprimer en français. Et je me nomme Sano Théophile. Je suis médecin de santé publique. Je viens du Burkina Faso. Je suis du ministère de la Santé et je coordonne une unité qui a été mise en place pour gérer les transferts de connaissances et également tout ce qui est performance et résultologie au niveau du ministère de la Santé. Donc cette collaboration avec les chercheurs pour influencer les différentes décisions au niveau des autorités. Merci.
Hello, I'm Kwasi Damus Paquin. I'm from Côte d'Ivoire. I'm professor of public health at the University of Alassane Ouattara, and I'm also head of the epidemiological surveillance in Bouaké at the National Institute of Public Hygiene. Thank you.
Good morning, everyone. I'm Abdul Salam Wedraogo. Oh, sorry. Oh. Okay. So I was talking alone. I'm Abdul Salam Wedraogo from Burkina Faso. I'm professor of clinical microbiology, and I'm right now the director of Centre Muraz, that is part of National Institute of Public Health. Our center is an historical center of Burkina Faso, even in West Africa, focused on pandemic fighting, and we are hosting right now 2 reference labs. National Reference Lab on antimicrobial resistance and National Reference Lab for hemorrhagic fevers. But at individual site, I'm coordinating right now a technical working group in West African WAO, West African Health Organization, to build regional surveillance for antimicrobial resistance. Thank you.
Hello everyone, my name is Julius Gedeinen. I'm from Liberia. I work at the National Public Health Institute and serve as the Deputy Director General for Technical Services at the Public Health Institute of Liberia. At NPHIL, we primarily responsible for detecting and responding to public health threats and for research activities within Liberia. So in my capacity at the Public Health Institute, I provide supervision for public health and biomedical research activities in the country, as well as emergency response, disease surveillance, training, capacity building, etc. Thank you.
Okay, good morning to all. My name is Stephen B. Kennedy. I'm from Liberia. I'm the thematic lead for infectious diseases at the ULPI Africa Center. It is an infectious disease research center based at the University of Liberia. Over the past multiple years, I've been actively involved in research on clinical trials, community-based, and also policy-related research in regards to outbreak response, especially regarding the Ebola virus disease, COVID, as well as lots of fever in Liberia. It's good to be here. I look forward to learning from experiences that will be shared at this forum. Thank you very much.
Hello. Yeah, my name is Ernest Kunedu Esiedu. I am also a medical epidemiologist by training and currently working with the National Center for Coordination of Early Warning and Response Mechanism. Our focus basically is on anything that threatens human security, and by my role, I'm representing the Ministry of Health in that center, but the focus ultimately looks at terrorism, extremism, violent extremism. We are looking at crime and criminality. We are looking at health, pandemic-related issues. We are looking at environment, social and economic challenges. We are looking at governance, leadership, and then gender as a cross-cutting issue. Our function is basically as in Ghana, yes. So our function is basically to coordinate human security challenges in the country. It's an ECOWAS and a country creation. So we have similar institutions in other ECOWAS countries. Currently, 12 of them are established, except for Togo, Senegal, and Cape Verde that are yet to establish their own. But we work across the borders and we share knowledge and then also pick other information from other countries so that we can manage anything that threatens human life. Thank you.
Reinhard Busse. I'm the head of Department of Healthcare Management at the Berlin University of Technology, one of the co-directors of the European Observatory on Health Systems and Policies, and director of the Berlin School of Public Health, which is an inter-university school. And as such, in my department and in these other institutions, we look at the role of health systems. We first did that, and we're still doing this, as Wilm, who's with me in my department, has already said. We first looked at European countries. We have the WHO Regional Office for Europe as a member in the observatory. We have the European Commission. We have many country governments, and we are set out to bridge the gap between what we know about health system functions, how they are financed, which results are achieved in terms of health, equity, cost effectiveness, responsiveness. And we have expanded that some time back also to African countries, not only first to Ghana under a previous project which led to the policy dialogues in Ghana, but now more recently, and together with our colleagues from the Charité and the University of Bonn in this G-WAC exercise. And I'm happy to be here and that we can share our knowledge about health systems in general with a more specific aspect of the pandemic preparedness. Thank you.
Good morning. I'm James Dear. I work with G-WAC as the Deputy Executive Director. I'm a public health physician. G-WAC, we are the second largest provider of health services in this country. We have presence in all the 16 regions, and specifically in about 200 districts. Our institutions collaborate with many of you who are doing research. We've played quite a key role in the COVID-19 pandemic response, especially in districts where the government doesn't have facilities. I think at the moment we are collaborating with WACBIB, and some of our staff provide data for the genomic sequencing. We also work with KCCR, some of our institutions, Agogo, Asimfosu, and the rest. We actually are the receiving end of the research that you do, and which is why I'm happy to be here. That all the research and policies should translate into good service delivery. So I'm very happy to be here. Thank you very much.
Thank you for the introductions. We have already been introduced, so we'll go straight. We are going to have a keynote address by an online presentation by Dr. Chikwe Ihekweazu, the Director of WHO Epidemics and Pandemics. And right after that, we're going to have some concluding remarks in this order. Dr. John Amoesi will be the first to speak, then Dr. Vilm Quentin, then also Johanna Hannefeld will also be speaking, then Professor Awindara, and to be ended by Prof. Akim Horof, in that order. But because they didn't give us a screen, we have to move here so that at least we can see what's happening here, so we can go down now. Thank you.
So good morning, colleagues. Thank you very much for the kind invitation. I would have loved to be back in West Africa to do this physically, but unfortunately it was just too difficult to arrange travel. So I'm really glad, and it's a personal honor to me to have the opportunity of sharing a few thoughts with you. And thank you, John, and all the colleagues for the invitation. I can see you have a full room of colleagues from around the world, especially colleagues that have traveled from Germany. So welcome to West Africa as well, to all of you. So sadly, I'm a little bit pressed for time, but I will try and share a few thoughts with you. This topic is very important for us. My name is Chikwe Ihekweazu. I am an Assistant Director General at the World Health Organization, responsible for health emergency intelligence systems and surveillance systems. It's a new division in the emergencies program and also incorporates the Hub for Pandemic and Epidemic Intelligence in Berlin. So I'll share a few slides to help me navigate this presentation. So I hope it's showing. I can't hear you, so let me hope that you can hear me and see the slides. I think I can see it on the screen. So, firstly, like I said, I lead this new WHO Hub for Pandemic and Epidemic Intelligence in Berlin. A few words on why a hub, why have we set up this new hub in the organization. As we went through the pandemic together, and I was in Nigeria at the time, leading the Nigeria Center for Disease Control, there was a shared experience that we had with almost every other country in the world, that our ability to collect, analyze, use data for decision-making and have the agility and the flexibility to do it in real time in order to inform our political leadership on what is going on and the action they need to be taken on a day-to-day basis was stretched to its very limits. So every one of us struggled. Whether you were leading the response in Ghana or in Egypt or in Germany or in the US or in Russia, everyone was struggling with the same challenges. How do we understand what is, not only what is going on in my country, but what is going on around the world? And how do I use that information to make decisions, the best decisions for my people in the short and long term? And we will all agree that in many cases, we got it wrong. And even when we tried our very best to make those decisions, we really did not have the framework to consider everything that we needed to. And countries that were very proactive in sharing information sometimes were punished significantly politically for it. There were other consequences of sharing, other consequences of not sharing. And basically the landscape for how to use data to make decisions, which is the theme of this gathering, has never been more important. And really that's the thinking that led to the establishment of the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, which I've now led for right about a year. So I thought by taking us through a few thought models on why surveillance and intelligence matters, so we can reach some consensus around this, share with you some of the initiatives going on at the moment, and end with a little bit about the hub itself. So firstly, on why surveillance and intelligence matters. You know, this is a really challenging space because success in the work that we do does not lead to any headlines. So when you do surveillance successfully at a local level, you identify threats and you respond to those threats effectively. No one ever hears about your work. This is just on the picture, a few examples analyzed by a group of colleagues on incidents that could have had all the characteristics to become significant outbreaks with significant costs in morbidity, mortality, and economic implications that were no one heard about because the response was good, surveillance worked, the event was detected and responded to, and it became more or less a non-event. And for well-functioning systems, there will be several of this happening every single day. At the global level, we hear of many plans around pandemic prevention that seem to assume that it's self-evident that a new incident will become a pandemic. There are many discussions about a 100-day plan, 100 days to that, assuming that when a new pandemic emerges, we will all understand that this incident will become a pandemic. But I put it to many of these colleagues that there are many incidents that happen every single day that colleagues like yourself detect and respond to that could become one, that never become one, either because the local circumstances don't allow that to happen, or our surveillance and response architecture and infrastructure has worked. And this is important for us to remember because it's only in considering this threat as a continuous global threat that we can frame the response to it. If we think about it as a single big bang effect that will happen in obvious circumstances, then we will lose really the real incentives to do the work that we need to do. And the other thing to emphasize here is what we understand as the value of surveillance is also variably defined and by different people and also by different perspectives, all of which are correct, but none of which are sufficient to give you the full spectrum of what surveillance should be doing. And very often, depending on your perspective, if you're responsible for epidemic and pandemic response, then you're very interested in detecting new and re-emerging infectious diseases. And many of us in West Africa have had our fair share of those and continue to have them and have to deal with that almost on a daily basis. But there are many other colleagues that are more interested in measuring the success of their disease control programs. If we think about a disease like measles, we've had an effective vaccine for 60 years, one of the most effective vaccines in the world, a vaccine that costs very little, yet we still have significant outbreaks of measles. So it's not just a question of new detection of new diseases in order to develop a vaccine rapidly. It's also the challenge of how do you monitor our performance as public health managers in the control of significant diseases that are still in circulation. And obviously, a new area of focus is on the elimination of disease as well. Not new, because we've been working on polio for many, many years. And for a while, you know, there's a lot of fatigue in the response, global architecture of response to polio. And the development of new tools using wastewater surveillance, for instance, which has detected the virus in the sewage systems in London and New York this year, has really emphasized the global threats that we continue to face and how we have to continue to respond to this, and our responsibility in developing new tools to this continuously. And also, when we think about infectious diseases, you know, we also have to remember that the risk is not constant, and the risk will change depending on several factors, some of them man-made, some of them natural, but all of them lead to an impact, an effect on our risks and vulnerability. So whether these are wars in parts of the world that haven't had this for a long time, or in areas of conflict that are ongoing, whether this is hurricanes or floods. We've seen an incredible amount of floods in West Africa this year, especially in Nigeria, as well as in Pakistan. All of these increase the complexity and severity of our challenges. And if our data systems are not inclusive in understanding these risk areas, then the monitoring of just the incidence of infections is not enough to understand where we are. But there's also some good news. Yes, areas of risk are increasing globally, and all of these are kind of global estimates. But there are many other factors that are also leading to that increase. But in a way, these can't really be seen as risk areas, even though they lead to a variation in risk. We can see an increase globally, incredible increase in the number of air travelers, in the exports of goods and services, in the growth of urban populations. And if we're not measuring and monitoring and understanding the interplay between these, and these is just a selection of 3, there are many others I could have put on this slide, then we are not in a really good position to understand how to respond. So the functions of data, better analysis, and better decisions is not only in the simplistic understanding of surveillance as it has been defined by many national public health agencies and ministries of health, but is really in understanding all the other factors that lead to a variation of risk and vulnerability to infectious diseases. And if we don't include these in the thinking towards our decision-making, it is not likely that we will make the right decisions for our people. So we have to really understand the full spectrum of what leads to the risk. And if we are not prepared to do so, either by how we have organized our institutions, the systems that we use, the collaborative environments that we create, then we are not in a position to really be confident in our ability to make these decisions. So a few points on the overview of our current landscape and what we're doing about it. And this is very important for you to know, even if you're not involved in the day-to-day transactions of it. But there is a significant focus on this now post, I wouldn't say post-pandemic, but at this stage of the pandemic, that we are all thinking collectively on how to respond to the realities of what we have just gone through. We can't come out of this pandemic and pretend to continue with business as usual. So at the global level, there are fascinating conversations going on at the moment around 3 spaces. And if you look at the bottom, I don't expect you to read any of the documents up there, but if you read anything, read the 3 words at the bottom of the 4 documents. 2 of them relate to governance. So significant discussions going on right now between member states. So Ghana is very much involved with this. Germany is very much involved on a new pandemic accord. So really redefining the governance. How do we hold each other accountable for a certain minimum of activities when we detect a risk? And what do we ensure that within our global community, we hold each other accountable to do? WHO is only the secretariat for these discussions. The discussions and the decisions will be among countries, so member states of the organization. And you will, or our countries will decide for each other what they are obliged to do as a responsible member of a global community. And really that's what the new pandemic treaty or accord, whatever term member states ultimately decide to call it, will use. There are also interesting reforms in the international health regulations being discussed at the moment, recognizing that the international health regulations, as they are currently prescribed, did not really optimally serve our purposes during the pandemic. So that's in the governance space, very important. The other space is in financing. Now, there's a new pandemic fund that has just been agreed. The name has just been agreed, to which many countries and philanthropic organizations are now committing funds. So there will be actually a fair amount of money available globally for pandemic preparation activities. The challenge, however, is unlike the funds available historically for the big global health initiatives like HIV, TB, malaria, Gavi for immunization. The areas in which to invest in for pandemic preparedness are not as clear as it was for Gavi, for instance, which was largely around the procurement and delivery of vaccines. For HIV, it was largely about the procurement, delivery mechanisms for diagnostics and antiretrovirals for HIV. For pandemic preparedness, the what to invest in is not clear. What exactly do we invest in to make us safer from the threats of infectious disease outbreaks? And that are the things contained in the last document, 10 proposals to build a safer world, where we're currently going through a lot of thinking in how do we redesign the health emergency preparedness and response architecture globally to make the world a safer place. And it is a very complex conversation going on to define exactly the what. This what, as it is being designed at the moment, we have put together a proposal by the DG of the World Health Organization in this document that contains 5 what we call interconnected health emergency preparedness and response subsystems. And of these subsystems, one of the most important ones is a term called collaborative surveillance. And that's a term that we are working within the hub in Berlin and our surveillance department in Geneva to define. The other subsystems are around community protection. So how do we learn from all the public health and social measures that we delivered during the pandemic? The second is on clinical care. Very often these have been separated. So the responsibilities for delivering clinical care have never really been considerably part of a public health response. But during the pandemic, we have seen how interconnected these are. And in order to make this work, we have to have a public health perspective to the delivery of clinical care globally. We have to think about scalability, provision of countermeasures such as PPEs, oxygen, as part of a public health response, not only as a provision of clinical care. How do we define countermeasures themselves, whether they're PPEs, vaccines, therapeutics, and all of that? And in the middle, we have coordination. But I'll focus my last few minutes on the concept of collaborative surveillance. Now, when we speak about collaborative surveillance, and colleagues, you will increasingly see this term in the global landscape in the next few months. So we're in a very privileged position here in Ghana today to be able to discuss this in detail, because this is a theme that will define our conversations in the next few months. What is collaborative surveillance, and how are we beginning to define this? So this is being defined around 4 dimensions. The first is across disease areas. So this is really taking the concept of integrated disease surveillance a step further, but as only one of the 4 dimensions of collaboration. So firstly is collaboration across disease areas. Secondly is collaboration across sectors. So really operationalizing the One Health concept and making sure the data flows find an intersection between each other. Collaboration across the event life cycle. So the detection, we very often focus on our ability of surveillance systems to detect new trends or incidences, but it's not only the detection of new threats, but it's how resilient is the system to monitor the disease and the impact of the disease throughout the event. And at certain points, the incidence is not as important as mobility data. Are systems well structured to get capacity data out of our hospital systems and things like that in order to understand the impact of the health system altogether. And thirdly is collaboration across geographies. And when we think about this, all of this needs to ultimately lead to better decisions. If our efforts are not leading to better decisions, which is the goal, then we are missing the point. So if we integrate around these 3 subsystems across those 4 dimensions, and the imagery of a rope here is not coincidental, because it is our goal is for the rope symbolizes the strength of a collaborative effort, and that each of this is stronger than each of them individually when they work together. And ultimately, that we are in a better position that our leaders and our leadership and our ministers and whoever is making those decisions are in a better position to use our input to make those decisions. So that's a new concept that we're offering the world to move forward on, and really focusing that it is not enough to develop capacity. We also have to develop our collaboration. So it is not enough for any country in West Africa, for instance, Ghana, Sierra Leone, Nigeria, to develop its own capabilities. The strength that we have is how much we collaborate across. And not only collaborate across countries, collaborate across sectors. How much is the human and agricultural sectors collaborating operationally in defining risks? And if we don't achieve this, then we don't get to the optimal position that we want to. I will start concluding with a few thoughts on the hub itself and on the work that we're beginning to do here in Berlin. This is the response cycle that everyone working in outbreak response is aware of, from prevention to preparedness, response, and recovery. Every country has an institution with which to do this. In some countries, they are delegated to a national public health agency. In others, they are within a department in the Ministry of Health. Now, what we're doing is, in addition to this, really develop an infrastructure to do something, and you will recognize this theme because it sounds very similar to the theme of your dialogue session today, and really to develop the systems to use better data for better analytics in order to make better decisions. But basing all of this on the surveillance infrastructure that a country has set up already. And this in itself is what defines the hub that we're setting up in Berlin. Our objectives are not to collect data from around the world, but in a way to connect data in order to keep the world safe. So a good analogy is air traffic control. So if you think about the skies and our airlines, there's no one agency that collects all air traffic control data in order to manage our skies. Yet we have very few accidents. This happens because each country's air traffic control authority has developed a framework in of itself to communicate with each other. And so with that framework, the entire web across the skies is kept safe. So we have to think about our infectious disease space at the same time. It is possible to share information while still keeping a lot of the sovereignty that we tend to hold dear. We will innovate around new systems, new technologies, new ways of working to support the work we're doing. And of course, none of this is possible if we don't strengthen the existing human resources, staff, and systems that we already have in each of our countries. So this is just a high-level image of our new work. The light blue defines the new division. So the emergencies program in WHO was previously comprised of a preparedness and response division. And now we have intelligence and surveillance systems division as part of it to create this new architecture to support the preparedness and response work. And of this shaded part is the part that is defined as the hub that is based in Berlin, while the rest are based in Geneva. I won't go into all of these. These are all the projects within our division. Some of them are aimed at norms and standards. Some of them are capacity strengthening. Some of them are delivering services directly. And some of them are around the strategy and policy space. Just to recognize that there are many colleagues from the Robert Koch Institute in the room, and we are working very closely with them around specific projects around public health intelligence, genomics, and a fellowship that will enable colleagues from around the world come to Berlin and work with us on specific topics, especially fellows from national public health agencies in countries. And I hope that this will be a mechanism for many people in the room, ultimately to access the opportunities of collaboration with the hub into the future. Our work has involved also a lot of thought leadership. One of it is with Charité. Charité is the biggest hospital group in Berlin, academic hospital in Berlin. And together with them, we've set up a speaker series and many other projects in different stages of development as we try to define this space for the world. I'll skip this slide for interest of time, but you'll have access to it. One of the most important areas of sharing is a new space on genomics. And one important project for us is a new international pathogen surveillance network that we're setting up out of the hub. And through the last year, we've worked very hard in catalyzing not only our work, but in all our partners. And that's the reason I am attending this session today, to really pull in. We are creating a collaborative space, both physically and in terms of our breadth of collaboration, and really invite all of your ideas and yourselves to join us as we think about the future that we're trying to create together. So thank you very much for the opportunity, John, colleagues. It's been a real pleasure. I honestly wished I was able to come to Ghana today, but at least I've shared a few thoughts with you. I look forward to your feedback. Unfortunately, I can't stay for too long, but I wish you a successful meeting, and I hope that these few words inspire some of the conversations that will happen for the rest of the day. So thank you very much for the opportunity.
Thank you very much. After this, I'm sure there will be a question or two, maybe a burning question or two, and we'll be happy to take them. Okay, John.
Thank you very much, Chikwe, for joining us. Apart from the depth that you provided and the content, just you taking the time to prepare this and spend with us is something that we appreciate very much here in Ghana, and also from G-WAC in general. given that this is really the WHO area where G-WAC really would be interfacing the most with. You touched on a couple of things, and I liked in particular what you spoke to regarding being able to appreciate the risk, and you made mention of, you know, what I would maybe summarize as complex socio-ecological systems. And given that these are so complex and require multidisciplinary approaches to them, I'm just interested in how the hub plans to make use of networks like ours, G-WAC, to feed the hub with the required information. What's the mechanism for receiving the research feedback that we provide? And then the other thing I wanted to touch on, which I think you actually addressed to some degree, was this collaborative surveillance, and you made mention of event life cycles and geographies as one. These were two out of many points you raised. But with the geographies, I worry sometimes about the borders. We like to say that, say in Togo has eliminated a bunch of NTDs and so on and so forth. But, you know, Togo is just next to Ghana, then next to Benin, next to Nigeria, and we are next to Cote d'Ivoire, and then Burkina up there. So one may think it's actually a bit of a misnomer when you say X has eliminated this and the guy next door has not eliminated it. How best, and again, you touched on this a bit, can we address this issue of borders within the scope of what the real risk is, knowing that these pathogens and causative organisms, and actually even the socioeconomic and wider climate factors really do not know any borders?
Thanks, John. You know, two complex questions as expected. I think the first thing to say is, you know, your question on how to engage with G-WAC, and it's something we will define together. So I'll give you just an example. In the development of the physical environment of the hub, so the last picture I shared, we have a space that will house 120 workspaces. We're filling only about half of that with WHO staff. The other half will be really to host colleagues working on specific topics that are important for us. And that is recognizing that the expertise required to deal with the complex realities of today cannot all be found or recruited for within our formal systems. So I very much look forward to defining specific areas, and I hope we can even start thinking about it now that our colleagues from the Robert Koch Institute are with you and others. The public health schools in Berlin. The key thing is to define areas of global health significance where you have a unique advantage, opportunity, both either in your capabilities or in your exposure to that threat, or in both, and work out how we can collaborate in thinking through the complex realities of that threat and how we can respond to it. So that's one immediate opportunity that I hope will evolve out of this meeting. To your second question, I absolutely agree with you that the political boundaries within which we have to think about concepts such as elimination are completely arbitrary and mean very little to the realities of life, especially in West Africa. You know, our colleagues working across countries, we have to really think about how do we collaborate better. And the hub is just one instrument to do that. There are lots of instruments in West Africa as well. The West Africa Health Organization, the new West Africa CDC, the individual countries, and really come together in a collaborative mindset and how to exchange that information. And not something that we can solve out of the hub in Berlin, but we're definitely hoping to contribute to those discussions and the mechanisms, building the systems. One good one already that we have developed in WHO that many countries are using is something called EIOS, Epidemic Intelligence from Open Sources. And many countries are using this system already in making decisions. And within that system, you can create environments to share. So you can decide to create an environment where, as long as both countries agree to share information across a broader geographical area than is politically defined, but the leadership in those two areas have to agree that they share risk in common and therefore are willing to share that information in order to mitigate the challenges that they face.
Any other question? Yes, please.
Maybe one more, then I do have to run. Sorry.
Yeah, thank you. My name is Stephen Kennedy. I'm from Liberia. Excellent presentation. Thanks very much. I really enjoyed the presentation. You spoke a little bit about collaborative surveillance. There's no question about it. There's no doubt, in fact, that collaborative surveillance has a significant impact in terms of better decision making, and it has the potential to avert potential outbreak. There's no question about that. But I guess what I think less emphasis was placed on is that for us in the honor resource setting of the world, say for example, Liberia, take a case example. Surveillance is probably really limited the VAC from the most affected community. It's a key challenge. Finance is a problem. So as a result, it has significant impact on decision making, and it creates a potential that we're going to have sporadic outbreak over a very long period of time. So the question then is, how do we address such a situation in honor resource or poor resource setting with the multitudes of problems that exist within the context of collaborative surveillance? Thank you.
Yeah, so my brother, I think you raised a very important question. But in terms of the resources available to countries, both from locally and globally, and I am fairly optimistic about the future in terms of resource availability. I think we have to work a lot harder to prioritize our areas of work within our government and advocate for that, but also advocate globally for more resource from the global opportunities. And globally, there's a lot of effort right now going on to mobilize more resources to focus on the work, because I think the pandemic definitely made the case for resources, and that is ongoing, like I mentioned, through the pandemic fund called the FIF and all the other global funding mechanisms. So I recognize the challenges, of course, across the continent, and also the variability of the depth of that challenge. And I don't underestimate it by any means. But this is not something that we can solve in a hurry. And I think groups like this are very well positioned to define the opportunities and where exactly we need to fund, especially in the intersection between research and public health, which G-WAC is very important in defining for the future. How do we support? There's a lot of discussions at the moment around vaccine manufacturing and things like that. Very important conversations holding. But at the same time, how do we support the training and development of the researchers and the scientists that will work in all these places, and make sure that the entire ecosystem is given appropriate support? And coming out of Liberia, like yourself, and I was in Liberia for many months during the response. I think there are many missed opportunities post the Ebola outbreak in building on the response in Liberia, and because the solutions were not as simple as many people imagined them to be. There was a lot of money going into building of infrastructure, of new labs and new public health EOCs. But that in itself is not sufficient to change infectious disease prevention, preparedness, and response architecture. We have to develop human capacity, develop supply chains, all these softer things that are a little bit more difficult to invest in, and work with local knowledge, local capacity to do so. So I think the key thing here is that I am completely committed to understanding the local realities and to collaborate in a way that recognizes the incredible amount of expertise that exists in every context, and therefore look to working with you through G-WAC, through the other regional structures, in developing a framework collaboration that serves the purposes of every individual country. It's a big challenge. None of this will be solved, but I'm hoping that by starting off with this spirit, that we can co-develop the future that we want to see in the world. So thank you very much, colleagues. John, I wish you a very successful rest of the meeting. And I look forward to continuously engaging with this. You've chosen a very important topic, one close to my heart, and I wish you all the best, and I look forward to the outcomes of your dialogue session today. Thank you.
Thank you very much. I think we should give him a round of applause for this.
Thank you.
Okay, so the closing remarks, 2 minutes for each speaker. Just 5 people, 2 minutes. So John, you start off.
Well, I had the privilege of, asking a question, and that took quite a bit of time. But just to say that I'm glad we've kicked this off. It is the first in hopefully a couple of series, and I think Vilm very eloquently explained what this is about. In as much as we are in a formal atmosphere, we really want this to be very informal and get to the depth of issues. Especially because us as academics and researchers tend to do a lot, but either do not engage, do not know how to engage, or we distrust the policymakers, policy implementers, or they distrust us. It's really important that there is dialogue, because dialogue is what ultimately, brokers a relationship and mutual trust and mutual respect. We've heard, stories of researchers, going away with data from public institutions and doing their own thing with it without recourse to the sources. We've also heard stories of public institutions refusing to provide what would otherwise be public information collected with taxpayers' money, making it available so researchers can use to develop or to do their research, which hopefully will improve policy. So really important thing we are doing, and I hope and when we're extending this beyond just Ghana to the sub-region, and hopefully to be useful.
Thank you, John. Vil.
Yes, thank you very much. In fact, during my earlier statement, I forgot to say I'm very happy that all of you are here and that we are really here now together in the room. And this is, when we started putting together the proposal for G-WAC 2 years ago, we had this idea of having a West African policy dialogue, and now we are all here sitting in the room really to discuss pandemic prevention. I think this is really a great achievement, and I'm happy that we have come so far, and I look forward to now interacting with all of you. Thank you for coming to Ghana. I know travel arrangements weren't always clear-cut and easy, and there has been a lot of planning, so I'm very happy that we have all made it and will be able to address the topics now in the next 2 days.
Thank you, Vil. Johanna?
Yeah, I'm going to say a couple of words just that were mentioned. So first of all, I wanted to say on behalf of the RKI, we're very honored to co-host this policy dialogue, and we'll explain a little bit about the background to that in the first session. So I won't pick up the theme that Chikwe posited in the hub of our partnership and how we can use that to connect with G-WAC. So we'll have a bit of time to focus on that. I think from our perspective, I just wanted to say, as a National Public Health Institute, we are obviously very much in this space between research and policymaking. So today's event is particularly important to us, and that's also why we're keen, not just because we're part of G-WAC, but also why we're particularly keen to support this. So the center that I head does at the RKI essentially does the national pandemic preparedness, but with international partners. But the reason why the focus for today's policy dialogue is so important, I think, is the pandemic showed two things, or two and a half to somebody working in that space I work in. The first is, I think, the massive importance of national level, right? So I think it's really great that we can come together and really share at our experiences at national level, because that's where the hard work has to be done, right? That's where those outbreaks are contained that Chico showed and so on. And the second thing is, for me, what it showed is that no national level can do it alone, right? So national level needs to collaborate with other national levels. So that's why I think a regional aspect, both in G-WAC, but also in this policy dialogue, is so crucial as an approach. And those ties and strengthening those ties are so important. And even as a National Public Health Institute in Germany, it's so important to be working with all of you. And the half point I wanted to mention is that my experience over the past 2.5 years has really been that policymakers have understood the absolute importance of data and of surveillance systems in a way that they have never before, right? So in my department, there's a unit called an epidemic intelligence. Nobody knew what that term meant. And now everybody in my government knows what it means. We have this hub in Berlin, and people are asking for information around it, right? So I think now is the time, in a way, to as researchers, but also as those working in between and going in between, to better articulate that value chain, if you want, of how we get from the better data to the better analytics to the better decisions, right? So we have to sort of find a way to broker that, and that's why we're particularly keen to sort of, or happy to support this policy dialogue, and also look really forward to the coming days. So thank you very much all for traveling, for coming here, and really look forward to the open interaction. Thank you, Chair.
Thank you, Joanna. Prof. Windari.
So I want to really appreciate the organizers, John and his team, for inviting me here. I'm very honored to be in this meeting. I realize that I'm a minority from University of Ghana. This is a very heavy KNUST event. Even though it's in Accra, it seems I'm the only one from University of Ghana here. So I feel honored that I've been invited to this table. On the theme about pandemic preparedness, usually my opinion about this is that I believe that the best way to prepare for a pandemic is to have strong ongoing surveillance, because what the current pandemic has taught us is that the countries that were able to respond best were those that had strong systems in place already for dealing with endemic diseases. And so when there's a pandemic, it's much easier to redirect resources and expertise to respond to a pandemic if you have a strong ongoing surveillance system. And I think that's one of the lessons that we should learn from this, that we should not overemphasize preparedness for a pandemic. Let's emphasize preparedness for our daily challenges. And when there's an emergency, it's much easier to respond to an emergency that way. I mean, later on we have time, we'll talk about WACB, for example. Our role we played throughout the pandemic. We were able to do that because we're already building capacity to do these type of things for other diseases. Most of our capacity was for doing malaria, but we're able to turn that around and use it to do COVID-19 work. And that's what put us in a strong position. The last thing I want to mention is that there's already a lot of emphasis on the need for strengthening at the country level, and I think that is really critical. And particularly with data. I think there needs to be much more data integration. I have suggested to our Ghana Health Service that they need to set up a data team that has the technical expertise to basically collect all the genomic data, cure it and turn it into usable information for the the Ghana Health Service on a daily basis. So we have KCCR doing genomic sequencing, WAC we're doing genomic sequencing, Uguchi they are doing it, UHAS doing it. Even within country, all our data is in silos. There's nowhere that you can find all the genomic sequences in Ghana in one database, except in GSAID, which is in the cloud somewhere. So it is critical that the Ghana Health Service can wake up in the morning and say what variants are in Ghana as at now, and click a button and see. They don't have that. They have to call us and ask us, and call cases here and ask them, and call UHAS and ask them what they are getting. This should be something that should be ongoing. And that is because we need the technical expertise at the national level. We need strong bioinformatics capacity. We need strong data capacity, data analytics capacity. And this should not only be at the academic level, but also at the level of the public health institutions. And if we can build that capacity, then we will be ready to respond to any emergency because there will be an integrated system that can provide information within a short period of time. Thank you.
And then the last word, Professor Akim Harrow.
Yeah, thank you very much. Actually, I was surprised to be given a few minutes, and during the great talk by Dr. Chikwe, I decided to bring in the perspective of the entities, since there are a lot of entity researchers in our G-WAC consortium, and some of you may have already asked why is that so. So, for example, there's Professor Alex Debra, with whom I have collaborated for 20 years on NTDs, and Dr. Linda Batza-Debra, and also Dr. John Amwasi is head of the African Network for NTDs. And so what does NTD actually, NTD research and also NTD implementation bring here on the table? And when Dr. Chikwe said in the beginning, if everyone does the job in a pandemic, it doesn't make headlines. And it's a little similar with NTDs, I would say, because there's a lot of engagement to control NTDs as much as it is with the global big three like malaria, TB, and HIV. And the preceding speaker has already mentioned, we can build upon these capacity buildings, and also on the digitalization of data that is also happening to a large extent with NTDs, build this capacity and be better prepared. You can only be prepared against pandemics so much, but what you can do is prepare the people, get data systems, digital systems in place that you can respond more quickly. And I think this is what we want to bring together also within G-WAC, and where we see our place with entities. And I think that's also important, that this is a constant capacity building effort. The PhD graduated that are now lecturers and professors, mostly at KNUST, but also elsewhere in Ghana and in other partner countries of our networks that we have on entities. So we are really happy to bring this together with the more preparedness and public health aspects that Johanna mentioned, for example, and we think this is of very mutual benefit. Thank you.
Thank you, Akim. We left out the National Centers for the Coordination of Response Mechanism, Dr. Siedu. Is he here? If you could just give us some remarks, then we end.
Thank you very much. So, like I said during the introduction, the center is a new creation between ECOWAS and then member states. And as I mentioned, 12 countries at the moment have set up their centers. And there are 3 more that are yet to set up: Togo, Senegal, and Cape Verde. But Ghana is one of the few countries that was established with an act of parliament in place in August last year, and the center was launched in November last year. So virtually we are on the 12th of November, we were 1 year old, and the focus, and as the presentation was being done, it was really resonating as far as health intelligence is concerned. But beyond health, we are looking at the other human security threats. And you recall that during the COVID-19 pandemic, security, border control, customs, immigration became very critical beyond just what health would have done. So that kind of coordination hub has been strengthened, and that's the focus of the center. The center does not respond, but works closely with all the responding agencies, ministries, and departments, and also to hazard some response options. And then ultimately, we do some kind of evaluation. So I'm also very excited to be here, and I think it gives the center also an opportunity for us to do some kind of collaboration, and to commend the earlier keynote presenter that yes, if we do not collaborate, then we might not be able to achieve what we need to do. But again, in our center, our role is to collect data. It's, I would say it's a center of excellence for data collection and research and analysis. And so we are also open to collaborate with other agents and institutions to be able to work together to secure the human person. So basically that's it. Thank you very much.
Very much. Before we go for the coffee break, I would like to first thank His Excellency, the German Ambassador, Daniel Krul, for his support for G-WAC and this activity. He has stood behind us steadfastly, and we appreciate you, sir. Now, there is one thing I will not do, attempt to give closing remarks summarizing what the speakers have said. So we're going for the group photograph, and then we go for a coffee break. Thank you very much.
So we'll step out for the group photograph, so out the doors, and the photographer is there. He'll direct us how to stand.
Recording stopped.